Did you know more than 80% of our patients are hypothyroid and that electroacupuncture is one of the best ways to help them? If that caught your attention, stick around, because in this episode, I'll be sharing powerful electroacupuncture protocols for the thyroid. You'll learn exactly how to implement effective protocols for both hyperthyroid and hypothyroid conditions, identify which acupuncture channels are most influential in thyroid health, and apply these protocols successfully to enhance patient outcomes in your practice. My name is Dr. Jeremy, and I help acupuncturists like you achieve breakthrough results with the world's most cutting-edge electroacupuncture techniques. If you're not already subscribed, click the subscribe button so you're notified each time I release a new training video. And as always, I've included a free downloadable resource with this episode titled Electroacupuncture Power Protocols for the Thyroid. Make sure to grab your copy before you go. Ready to dive into thyroid health protocols? Let's begin.
We said stomach spleen channel, you all are awesome, you figured it out, stomach spleen channel feeds, and then also the autonomic nervous system through the triple energizer and PC channels have a role in thyroid function. But then again, we're back to try to rule out earth channels first and try to rule out fire channels first. Okay, let's see here. Not only from a acu-channel viewpoint, fire channels if they're an issue, and earth channels if it's an issue, we can treat from a neural level issue. There is a branch of the vagus nerve here, which is called the superior laryngeal nerve, feeds directly the thyroid, so that, let me blow this up a little bit here. Okay, you find stomach 9, which for us is halfway between the Adam's apple and the medial border of the SCM, which should be around here. So if stomach 9 is here where my little mouse arrow is, you move a quadracin superior, quadracin medial, and now you're putting electricity directly on the superior laryngeal nerve. But how do we know the electricity is not going up this way versus down into the thyroid gland? Well, if the thyroid gland's diseased, it's reduced electrical resistance, and the electrons flow for reduced electrical resistance directly into the thyroid gland. Oftentimes, if you do this point with some electricity, the patient leaves your office having their thyroid produced more hormone. If you put electricity on any peripheral nerve, it will release acetylcholine, like a gland, and that acetylcholine stimulates function at the neural junction, which goes into the thyroid. But that is a branch treatment. Unless you fix the channels, then you'll be seeing that patient a lot. You have to fix the channels to really get a permanent reversal, and you have to stop the other leaks too. And we're going over 7 Ichi leaks, and one leak can bleed over into another, and that's okay. A dental can cause an immune can cause a thyroid can cause an adrenal. They're all linked together, but we just kind of dance around and get the patient better. Let's see. Yes, this slide. This is what I was talking about before, where if we take thyroid out of the equation, these are most of the things that iodine is needed for, an awful lot. Brain and nervous system, crucial for proper brain development in a fetus. Plays a key role in brain dopamine and GABA, and deficiency can lead to reduced alertness and lowered IQ. Iodine is vital for the structural integrity of the connections of the muscles, the ciliary muscles of the lens and eye, and the integrity of the blood vessels feeding the eye. Salivary glands, we said earlier, any gland that secretes something needs iodine to do it. So we have salivary gland, we already went over thyroid gland, breast and mammary gland, skin needs iodine for sweat glands to function, ovaries and prostate has roles in all these. Iodine's concentrated 1,000 times more in the muscles than in the blood and is needed for proper muscle function. And then you have factors known to increase iodine deficiency or block its availability, reduced consumption of, forget about that. Yeah, this is just talking about how they got rid of iodine in the food system. So we said it carries secretions from inside cells to outside the cells. Cysts in the body are caused by iodine deficiency. Kills all pathogens. Oh yeah, this is really cool. It kills all pathogens. This is why they dump it on they use it in surgery, they use it in wound care, because they know it kills everything, and it's awesome. And no buggers can get immune to it. And this is a artificial intelligence representation of iodine transporting toxins from inside the cell to outside the cell. What do you think? Pretty good. I'm impressed.
Nuclear, right? People get radiation too.
Yes. So iodine. Oh, sorry. Okay. Can you repeat that question?
No, I was saying, like, I know that they give it to people when they're exposed to radiation, like.
Yeah. Okay. So she said that they give iodine to people who are exposed to radiation or about to be exposed to radiation. So like a military setting, they try to load up iodine. That's because we know a lot of iodine goes to the thyroid, and so if there's radiation in the iodine, that will go to the thyroid. But if you can supersaturate your body and your thyroid with regular non-radiated iodine, then you won't uptake the radiated iodine. Iodine deficiency is a leading cause of ADD and ADHD. It's necessary for proper brain function. A fetus needs 5 times more than mom. Low maternal iodine can lead to miscarriage, birth defects, failure to thrive, mental retardation. Very little iodine in U.S. farmed foods. Remember I showed you that slide where we used electricity to get the clumping red blood cells into non-clumping red blood cells? Well, there's also a similar study where clumping red blood cells, and then they start taking iodine, and that also has a beneficial effect for declumping and fixing the environment of the blood, because remember, 60% of thyroid function is total body voltage, including the blood as one of our tissues. Very little iodine in U.S. farmed food. There used to be more. This is cool. It effectively treats food poisoning. So if you get home after eating dirty McDonald's, take a bunch of iodine, like 50 milligrams. You'll feel better. This is cool too, UTI or bladder infections. So if you have a UTI or bladder infection, this works better if you've already been taking it and you're supersaturated. Otherwise, the iodine may not end up in the bladder. Your body will keep it for itself elsewhere. But if you are saturated or been taking it a while, and then you get a UTI bladder infection, which you won't because you've had iodine, but if you did, then you would take couple massive doses, like 50 milligrams a few times a day. A lot of the iodine will end up in the bladder and just kill the infection. And I wrote here, adult needs 12 to 15 milligrams a day. That's starting. Robert O. Young takes 150 milligrams a day. I took 150 milligrams a day for a while, but it was super expensive. But it was like, the more you take, the better I feel. That's what it was similar to. Oh yeah, felt a ton better. Now I try to do 50 milligrams a day, which is like a balance between my wallet and my health. But there's a lot of fear in the world, and a lot of people are against what I'm saying. A lot of our patients' primary care doctors are against what I'm saying, which is why 12.5 milligrams is a safe dose. The functional medicine doctors use it. 12.5 milligrams a day. And everybody should be taking 12.5 milligrams minimum a day for the rest of your life. And that's because there's so many toxins in our environment. Like Fukushima 2011, remember that Japanese power plant, radiation, spillage, Everybody was scared for a while, and then now you don't hear anything about it. Is it still radiating? Probably. I place money it's still radiation polluting seaweed that I buy at the store, or saw in the atmosphere. Who knows? 12.5 milligrams, everybody. Everybody listening to me now, also try to get your patients 12.5 milligrams with cofactors. Remember, you don't want to cause Hashimoto's from taking just pure iodine without selenium. You only need a little bit of selenium. Cofactors are in multivitamins, so if they're on a multivitamin, you're okay to give them. You're generally okay, as long as your multivitamin is not GMO. It's pretty difficult in Kroger to find non-GMO stuff. Difficult, like maybe only 5%, 95% has some sort of GMO relationship. I'm still searching for non-GMO Advil. Organic. Every person should take it to prevent infections and the C word. Don't know what that is. And for overall health and wellness. Here's that thing I was talking about, hypothyroidism or fluoride poisoning. Because even if a patient's taking iodine, but they're also drinking sink water, that iodine is being kicked off of this receptor here. So even if this tyrosine molecule is loaded up with iodine, and we call that thyroid hormone, and then you drink fluoride, it knocks off this iodine and it takes its place, and this turns into fake thyroid hormone. And that has to do with the fact that both iodine and fluorine are halogens. Most blood tests do not show fake thyroid hormone. It's that reverse T3, reverse T4 to show that. Now, you can get a permanent damage from the thyroid. Think about scarring, which is one of our 7 Ichi leaks. If you get scarring in the thyroid, scars displace normal cells from regenerating in that physical location. How can we get rid of that? High-dose digestive enzyme. Remember I showed you that x-ray. Let's do a treatment and break things up a bit. Who wants a treatment?
So, what did you think? I'd love to hear your thoughts, so feel free to leave your comments or questions below. Remember, I've created a valuable downloadable resource called Electroacupuncture Power Protocols for the Thyroid. The link is in the description. Be sure to grab your copy and start implementing these protocols in your practice. If you enjoyed this episode, go ahead and hit the like button. And if you have any colleagues who could benefit from learning these electroacupuncture thyroid protocols, feel free to share this video with them. For more information about my courses and advanced electroacupuncture techniques, visit electroacupunctureinstitute.com. Thanks for watching, and I'll see you in the next training episode.